Good morning, everyone. Today I'll be taking a lecture on diet and nutrition of time. Now, the deficiency of vitamins can be classified as either primary or secondary. A primary deficiency occurs when an organism does not get enough of the vitamin in its food. A secondary deficiency may be due to an underlying disorder that prevents or limits the absorption or use of vitamin due to a lifestyle factor such as smoking excessive, alcohol consumption, or the use of medication that interfere with the absorption or use of the vitamin. Okay, so well-known human vitamin deficiencies involve thiamine that includes beriberi, niacin which includes pellagra, vitamin C, the deficiency of which leads to scurvy, vitamin D, the deficiency of which leads to rickets. In much of the developed world, such deficiencies are rare. This is due to an adequate supply of food and the addition of vitamins and minerals to common foods often called fortification. Vitamin B2 or riboflavin. Riboflavin deficiency can develop in patients with severe liver disease, diabetes mellitus, and chlorhydria. Angular cheilitis is a classic sign. Tongue is swollen after a period of time. It becomes dark red and atrophic. Seborrheic dermatitis like rash involving the nasolabial fold and ears, erythema with fine cracking and skin. As you can see in the image that has been given, nicotinic acid, a deficiency in nicotinic acid is known as pellagra, a disease characterized by the four Ds, that is dermatitis, diarrhea, dementia, and death. The lips initially appear wet and licked. Varnish scales are also seen on the skin. The tongue at first is swollen, but later becomes darker red and atrophic. The tongue gives the appearance of a beef stick tongue with a burning mouth. Dryness and fissuring can cause pain, especially when eating. They may also have erosions and apocrine ulcerations. This is a sort of a example that we see in patients with pellagra. Now coming to the oral findings include a large beefy red tongue, fiery red and painful oral mucosa, profuse salivation, acute necrotizing ulcerative gingivitis, dysphagia, and management is 50 to 300 mg orally for 2 weeks. Now coming to vitamin B6 or pyridoxine, patients taking isoniazid or less often cyclosporine or penicillin may become deficient in pyridoxine. Chronic alcoholics, especially those with severe cirrhosis, tend to have lower levels. Both cheilitis and a red tongue have been seborrheic dermatitis like rash has been described for the lack of vitamin B6 patients. Vitamin C is an antioxidant. The recommended dietary allowance is 90 mg daily for adults, 45 to 50 mg daily for children. The deficiency may lead to a spontaneous gingival hemorrhaging ataxia. The classic cutaneous findings in scurvy are seen on the legs. They include follicular hyperkeratotic papules, lichen scorbuticus, and perifollicular hemorrhages often associated with corkscrew hairs. Vitamin C is an essential cofactor in collagen metabolism. Its most common source, as you can see, is from oranges and lemons. Oral findings. Initially, there may be gingivitis involving the interdental papillae, especially above the incisors. The process spreads to involve the wide areas of the gingiva, often with bleeding and ulcerations. The teeth may become loose and fall out. Palatal hemorrhage. The tongue is usually not involved in scurvy. In children, the development of bones and teeth is hindered, as osteoid and dentin are highly dependent on vitamin C. In adults, there may be bleeding into the dental pulp as well as degeneration of odontoblasts and resorption of dentin, as you can see in the image that has been provided. The significance of vitamins in growth. Vitamins are essential for the normal growth and development of a multicellular organism. It requires certain vitamins and minerals to be present at certain times. These nutrients facilitate the chemical reactions that produce, among other things, skin, bone, and muscle. If there is a serious deficiency in one or more of these nutrients, the child may develop a deficiency disease. Now, coming to the recent concepts, now with evolving nutrition, the concepts of nutrition across the world has changed, and some of them have gained momentum in health and disease over a period of time. We'll be covering probiotics, prebiotics, symbiotics, type 1 and type 2 nutrients, and rainbow revolution. Now, there are various different kinds of nutrients such as the free radicals and antioxidants, smart nutrients, super nutrients, superfoods and super antioxidant foods, truly zero calorie foods, negative calorie foods, super antioxidant foods, and genonutrients. Probiotics. Probiotics are a general term for nutritional supplements containing one or more cultures of living organisms, typically bacteria or yeast, that when introduced to a human or animal have beneficial impact on the host by improving the endogenous microflora. Successful probiotics are capable of resisting the insults and transiently take up residence in the gut. Prebiotics are foods that promote the growth of probiotic strains of bacteria that can be administered alone. Synbiotics are foods that promote growth of probiotic strains of bacteria in combination with probiotic bacteria as one conjugation. Now, type 1 nutrients. When a nutrient is subject to a regulatory minimum, vitamin C added to a flavored drink, or a regulatory maximum, example low fat, the total amount highlighted by claim including any amount due to natural occurrence. Type 2 nutrients are nutrient which is present in food and for which there is no regulated minimum or maximum. The rainbow revolution, now in limelight to cultivate and consume colored, that is violet, indigo, blue, green, yellow, orange and red, especially pure vegetables and fruits of micronutrients and antioxidants. It ensures the adequacy of essential vitamins, minerals and antioxidants required to prevent the hidden deficiencies. Free radicals and antioxidants. This hydroxyl radical is designated as a free oxidant radical. Gomberg first discovered free radicals in 1900. Free radicals simply join on by addition to another to render the latter to a free radical. Antioxidants can be defined as a substance whose presence in relatively low concentration significantly inhibits the rate of oxidation of the targets. Now, smart nutrients and supernutrients, brain-friendly nutrients are referred to as smart nutrients. Out of the several smart nutrients, four are currently called supernutrients. These are vitamin A, iron, folic acid, and omega-3 fatty acids. Superfoods and super antioxidants. When it comes to superfoods, the most basic ones are the super green foods. These include spirulina, chlorella, and blue-green algae. Chlorella supports the function of the brain and liver, improves digestion and elimination, regenerates the body, detoxifies the blood, protects against radiation, relieves inflammation, supports healthy weight loss. Blue-green algae, known as superfood for the brain, it is a potent anti-inflammatory agent as well as an immune enhancer, has strong antiviral components, it is high in chlorophyll and is an important blood purifier. Truly zero calorie foods. Water is the only truly zero calorie food that occurs naturally. 8 12-ounce servings, that is 8 to 12 glasses of water every day, are suggested as a healthy part of any diet. Now, coming to the negative calorie foods, there are several fruits and vegetables that occur in nature that, while they have calories when consumed, actually result in negative calories to the body after digestion, because these foods cause the body to extend more calories to digest them than they have through their nutritional content, that they become zero calorie foods. Examples are apple, asparagus, beetroot, broccoli, cabbage, lemon, carrot, mango, orange, cauliflower, garlic, onion, papaya, etc. Super antioxidant foods. The seven super antioxidant foods are cooked tomatoes, turmeric, blueberry, wheatgrass, broccoli sprouts, grapefruit, and onions. Genonutrients are substances found in foods and plants that have the ability to affect gene expression. Example, antioxidants like vitamin C, polyphenols found in red wine. Minerals. A mineral is a naturally occurring solid chemical substance that is formed through geological processes and that has a characteristic chemical composition, a highly ordered atomic structure, and specific physical properties. Major minerals include calcium, phosphorus, sodium, potassium, and magnesium. Function of minerals: as a constituent of bone and teeth, as soluble salts present in our body fluids and cell contents, which provide stability. Some minerals needed for specific functions, such as iron for formation of hemoglobin, sodium for formation of thyroxine, cobalt as constituent of vitamin B12, zinc as constituent of enzyme. Now, coming to the various minerals such as calcium, the actions are bone tooth formation, blood clotting, nerve muscle function. Sources are milk-based foods: phosphorus, magnesium, potassium, chloride, sulfur, sodium, fluoride, zinc, iron, and copper. Now, water is a vital nutrient. It varies from 50 to 60% of body weight. Two main compartments are extracellular and intracellular. The functions are electrolyte balance, metabolic reaction, solvent stability, vehicle to transport, and temperature regulation. The water requirement is based on body size. For children and for infants, it is nearly 100 to 120 ml per kg body weight, 60 to 80 ml per kg body weight, and in adolescents, it is 41 to 55 ml per kg body weight, and in adults it is 20 to 30 ml per kg body weight. Now coming to various eating disorders, disordered eating that is seen in children and adolescents are different. In children we see rumination, psychological dwarfism, pica and childhood obesity. In adolescents we see anorexia nervosa, bulimia nervosa, orthorexia nervosa, athletica nervosa. The risk for overweight is between the 85th to 95th percentile. Overweight is usually above the 95th percentile. The causes are for TV and video games, emphasis on education, advertisements, pampering parents. The management includes diet counseling, changes in dietary habits, and referrals. All of which, in turn, is a classification for childhood obesity. Coming to anorexia nervosa, it is found in 0.5% to 1% teens. Four diagnostic criteria are seen: a refusal to maintain body weight that is equal to or greater than 85th percentile, intense fear of gaining weight, distorted view of one's body, absence of at least 3 consecutive menstrual cycles, and it is a growing trend in Indian teenagers. Bulimia nervosa, it literally means ox hunger, seen in 1 to 3% of the population. The detection is difficult. Diagnostic criteria: eating large amounts of food in less than 2 hours, lack of control over eating, compensatory behavior to prevent weight gain, which includes putting your finger and trying to induce vomiting. And the uh, Princess Diana was one of the most famous patients for bulimia nervosa, and this is again a growing trend in Indian teenagers. Now, coming to the oral manifestations, it leads to perimyolysis, that is the pH of vomitus is acidic. It is between 2.9 to 5.0, translucent, glassy appearing enamel, and it leads to a raised margins of amalgam restorations. Diet and health guidelines for Indians according to ICMR is that you should aim for healthy weight, be physically active each day. Let the food pyramid guide your food choices. Choose a variety of grains daily. Choose a variety of fruits and vegetables daily. Keep food safe to eat. Choose a diet low in saturated fat and cholesterol and moderate in total fat. Choose beverages and foods to moderate your intake of sugars. Choose and prepare foods with less salt. And if you drink alcoholic beverages, do so in moderation. Thank you.